would it be okay if we actually introduce ourselves, and just so we know who we are and why we've come to the conference, from what background? So Martin, do you want to go first?
Yes, by all means, thank you. I'm actually a semi-retired careers advisor who, can I say, got into the whole medical school application thing via my daughter, actually, who some years ago, 2006, actually decided that she was going to pursue a career in medicine, and obviously working for a careers company. Found myself in the right place at the right time, and went around various medical schools and conferences and seminars and such like, looking for the combination lock. And that led on to an association with Cardiff Medical School, who were concerned about the few numbers of Welsh students who were applying to Cardiff, and I got involved in some of their outreach programs, then became lay interviewer, etc., etc. And I'm now actually supporting a MedSoc group at my local comprehensive school, where I'm actually a governor. And I'm pleased to say, just the other day, one of my group got an offer from Liverpool, Fiona. So
right, well, it would be this morning, because we're cutting it close to the wire. Believe me, we had about a very big discussion yesterday about, we're not going to get them all out before Friday. How many do we release? Because it's going to trigger the phone calls. Because so the race is on, and so yeah, so congratulations to her. That's good, to your student. So what area are you in currently with your MedSoc Society?
We've run the program begins about February half term time, and I then walk them through. Well, the first stage is, do you really want to be a doctor? Do you know what actually doctors do? Have you explored the alternatives? Do you have the necessary skills, aptitudes, personal qualities, etc., etc.? We haven't lost anybody yet. I think that will come. The group of about 15 of them. They're quite a disparate group, as you can imagine. So then actually we move through the usual things. Actually, we come back in April, 14th of April, and although we're only obviously several weeks from the UKCAT thing, I'm already under pressure to talk to them about that. But then actually we'll get onto the much more interesting stuff. I thought it was quite interesting, one comment you made this morning about the value of mock interviews, and how it's much more important actually that we get into a discussion thing. And that's what I've been doing actually with them, is sending out. But one thing I'm aware of course, we're all aware of, is that this age group does not access mainstream media in the way that so I've been having to feed them with sort of articles and news cuttings, etc., pieces from BMJ, blah, 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 blah.
Okay, yeah, you seem a bit further advanced than I would have been with that thing. Some of the things will come up in the presentation, Martin, so feel free to add in as we go through it, because I'm going to stop and try and get all our opinions on various things about it. Juan, what's your background, and did I pronounce your name properly there?
Yes. I feel quite at home, because I'm a graduate from the University of Liverpool. I did my MSc and my PhD there in maths, but I was in the maths department and I taught there. So I feel quite comfortable, because Liverpool is a great place to study. And when our students talk to me about the University of Liverpool, I said, just go there.
Keep sending them.
Yes, well, I'm in a sixth form college. Well, no, actually, I'm in a further education college, and having taught A levels for a long time, we decided to. Well, there was this opportunity in a college in Skelmersdale, which is just on the outskirts of Liverpool, West Lancashire College, and we decided to, with the support of the CCG, we started a School of Medicine. So basically, we offer A levels plus work experience, and obviously we were supported by a person called Yvonne Thompson, who is in, I think it's West Lancashire and Cumbria, and she helped us to create a little pack for the students to start them to get reflected. So obviously they know they want to do medicine. They do like a set menu of A levels, so they can do maths, chemistry, biology, and psychology. So obviously they have to do biology and chemistry, and they can choose. So obviously, very much, I'm in Martin's, kind of game, trying to.
Oh, we've lost one.
Create, aspiration and motivate. They say it's inaccessible. It's only for posh kids. Everybody who does medicine has come to, because in my previous experience, my previous place, I was in a place called Winstanley College, and all the successful medical applicants used to have, parents who were doctors, or, they had the contacts to get the work experience. So I thought, I'm going to mean it. I want to have all kids to have access to a good quality experience.
I think with Stanley College, actually, a lot of the children, I think, they can probably cut this out the video, but I think a lot of the children in your area who have the higher GCSEs probably perhaps travel to Winstanley for their sixth form studies sometimes, because it is sitting on that boundary, and they do actually take quite a big mix, I believe, but it is just sitting, because I'm aware of your course, because I've been out at your college of an evening. So yeah, I wish you luck with it. Jacqueline, before we actually start, do you want to come in and just introduce yourself? I must admit, I've forgotten what year you're in, because COVID and that year break has knocked me silly. I'm not quite sure what.
So I'm Jacqueline. I'm one of the third year medical students. That sounds like I'm on placement. We've just got so used to it. My background is I'm like first generation from like a really poor area, kind of. I did access to medicine kind of thing, so I'm really like want to get involved with widening access to it, and I try and help out like open days and things like that.
Yeah, you've done a good job for us, actually, Jacqueline. Thanks very much, and thanks for coming today. And I'm glad that you're enjoying your studies. I hope you still are. Not seen you for a while.
It's been a stressful year, but we'll manage it. So.
Yeah, I think it's been stressful for everyone. I noticed a bit on the chat, and I think our students coming for help is increased in the well-being, but actually, to be honest, some of that, like my own academic advisor, had a chat to, I got a worrying email one Friday night, and I actually spoke to her the next day because I was worried about her, but actually sometimes it was just that contact, isn't it? It actually came to nothing. But I think the stresses are emphasized in this sort of situation, aren't they? So I'm gonna start by showing my slideshow from beginning, see if I can do it better this time, and share screen. Can you see that one? It says building confidence and ensuring your students' well-being. Yeah.
Yes, thank you.
So I thought how I'd work it is, and because we're such a few of us, I was thinking about, where would you start? And I was thinking of my own daughter, I'd mentioned, and I always say to her, what's the worst thing that can happen if you go into an exam or into a situation? If you're prepared in advance, you know that you'll cover most of what is thrown at you. And if something that's unexpected crops up, it's likely that other people have been faced of it as well. So I thought the things that needed to be done were getting that preparation right at your level with the children, the young people you're dealing with. So a lot of these things we covered this morning, so I won't spend too much on it. It's researching the career, and I think knowing the stages of the application process, because it really surprises me. I don't know that I emphasised it this morning. People who get an offer from us and then they don't know what a conditional firm offer means or a conditional insurance means, and they then don't really know about when to do their accommodation and things like that. And that can be quite complicated because it varies with the institution sometimes. But I do think that knowledge is power. And I do think that one thing that can calm people is actually knowing that time frame of, for example, when the admissions tests are, when you need to submit your application, and really that reassurance that it will be 6 months before you're likely. There may be some medical schools that say they release offers as they go along, and some do make a little peak at the beginning. But actually, because of the number cap, etc., most of the offers come later. So, for example, we just accept that Liverpool and say our offers are coming in one batch, but some do try and drip feed offers. But for the majority of people, they do need to wait until roughly round about this time. And I think managing stress levels for those students is quite important to know that, for example, this weekend when we've started to release offers, to know that it may be a number of days before we've released them all, and that it doesn't necessarily mean that it's a negative. And then looking at how to write the personal station interview preparation. You know, my advice in all of this personally is to direct the student, but empower them by creating the environment where they take on their own responsibility, because I think that is what gives them confidence. It's having done it by themselves and the knowledge that they know. So I think I would create the safe environment and time for them to review, for example, the Medical Schools Council website, because to be honest, that is an absolutely terrific resource. That's why we were all pushing it this morning. They put so much work and resource into it. And it might be, actually both of you are working with groups of individuals, so you can do it in a small group situation. And I would ask them to review the site and create their own plan or time frame for their journey. You know, try and think about when will they get their work experience, or have they had it? And then it would be reflection on it. Is there anything else they need to know? Reviewing the courses and the entry criteria, the UKAS choices, etc. That's how I would start the journey. It's by creating a safe space for them to show what they know about it, and then to write their own and develop their own plans about how they're going to learn. Because I honestly don't personally believe that it's good to just hand the information out. Again, I'm learning from the things that my child comes in and says about her school and about what her friends can and cannot cope with. And I think a lot of the thing is you cannot always run to the teacher, because they have so many students to cope with, that really you do need to get that within you. So widening participation, for example, I would say, this is the Liverpool web page, and for example, we've got various outreach schemes running from through primary to post 16, and I've only put that up to say that what does your local institution provide for the group of people you're working with. Now, it might be, if you're in like U1, you may have a WP cohort, I suspect, in your school. So it may be that they've missed Merseyside Young Medics, but they maybe have an age group where they could join into Scholars or something like that. So it's like looking on our website, for example, for you, and seeing, is there anything that we can do for you? Some of your students may be able to access our summer schools going forward. So other than that, we have general taster events that are for any kid, and there is a small cost to them, but they're much less than these very other expensive events. And we've got our open days. So I think they're of use, but I would say, like, look at your own local institutions and see if there are schemes that you're local institutions can help you direct your students to, or maybe your local medical schools may be able to do something for you. In terms of the admissions tests, there's basically, I think, for school type children, there's two that are the main ones, BMAT and UKCAT. As we know, BMAT tends to be a very academic test, UKCAT an aptitude test. So, I think you need to really get them on these websites. Both of you probably have experience of how you do it, but I thought that what we would do today is really, this was stuff that I did at our destination medicine summer school, which was for the year 12 students. So initially I gave them this slide and I said they should allow time to prepare for the UKCAT, maybe 30 hours you should spend preparing the test. So how are you going to build that into your plan of how you organize your time and with your other commitments? Start 4 to 6 weeks before the test date and make them aware that the free resources are available on the website. Now, BMAT has all these things too. So again, if you were dealing with a BMAT medical school, you'd go on the website, see what their resources are, and redirect this a slide. But the main thing is that there's official practice tests to familiarize themselves with. So my tips and advice for UKCAT was, if they'd not studied maths beyond GCSE level or recently, they'd to revisit and practice those skills before doing the subtests. They'd to brush up on their mental maths, because these are all timed events, and to practice their speed reading again. And I must admit, it's like, don't be fazed by abstract reasoning, although this may be new, you'll still soon start to recognize the patterns, color, shape. Now, I must admit, I tried tests and I was particularly bad at abstract reasoning. And I think then it just suddenly clicked that there is, once you kind of realized what the questions were kind of about, I suddenly became a bit better at doing it. Don't get me wrong, I'm never going to be excellent at that, but there is a kind of pattern to these questions. So people who go on to it cold aren't really going to do well. And the GMC guidelines are always good in relation to good medical practice if they're having difficult with the situational judgment tests. Juan, you've got your hand up. Do you want to come in? Just pipe up. So are you muted?
No, I just need to lower my hand now as well. So I'm just saying that, talking about the context of widening participation. For example, we have a student that unfortunately in school, he got a 4 in his English.
Yeah.
However, in the situational judgment part of the test, he got a band 1.
That's, yeah. But then again, I'm afraid I would need to say to you that I would expect that student to resit his GCSE and upgrade it.
No, but what I'm saying is, what I'm trying to say is that, I'm not saying that having a good UKCAT could trump the, but what I'm saying is that in terms of widening participation, it's just a question. If you think that a student that may not look that academic, inverted commas, because he hasn't got an average of 8, but he can demonstrate that he's got that potential ability in the reasoning and in, would that be taken? It's just a question of the value of the UKCAT.
Yeah, I think that the value of the UKCAT SJT, to be honest, isn't as well defined as at Liverpool. We would exclude processing applications if they get band 4, but I've never made any difference in judgment between bands 1, 2, and 3. And that's why I'd be more likely to go on the GCSE grade 4, because that's over a long period of time. It's writing, it's reading, it's comprehension. SJT, it's reading and you're clicking an answer. You're not actually writing. anything like that. So it's part in the reading and the comprehension, but not the full picture. So I think that's what I would say about that, really. But in saying that, you know, if you have a WP student, there's always second chances. You can upgrade those GCSEs. You can take time out and perhaps have some time out of education and re-enter via an access course like Jacqueline has done. So there are ways in which, and to be honest, you could go on with your A-levels while upgrading some of your GCSEs. People have done it. And it depends really how committed you are. Now, you may think that's an extra hurdle for your student, and it is, but I think I'm particularly concerned about bringing people on who might not progress, because fees are £9,000 a year.
He did a resit, and you know, and he got a grade 6. You know, he just did a resit with us in the college, and he got a grade 6. But what I'm saying is that if the UKCAT say the abstract, I was thinking actually as a mathematician, I was thinking more about the abstract thoughts and the other, that, you know, maybe the schooling of a student may not reflect their potential. That, you know, that as
no, that's true, and that's why we are flagging individuals via a contextualized data system that's at Liverpool, and I've given special consideration in relation to GCSEs and interview scores, whatever. Next year we hope to move to actually making lowered offers. There was a particular reason why we didn't do that this year. We do make lowered offers for scholars and ROGs, but not for just flagged applicants at present. And that was to do with actually the unique circumstances of COVID-19 and the failure to go over the cap, because what we don't believe at Liverpool is making a reduced offer conditional on you making us your first choice. And that was going to be a bit troublesome. So it's a case of watch this space at Liverpool for whether we do manage to commit to a full contextual offer next year, in the next admission cycle. So just going to move on just now. And
if I may, sorry, Fiona, I beg your pardon. Just one tip, if I could pass it on, about the verbal reasoning module on UKCAT. I like you, I've also had a go at the UKCAT and found the abstract reasoning one utterly bewildering. But actually, if you look at the UKCAT scores over recent years, the subtest that's got the lowest average score is actually the verbal reasoning. It's year after year after year, and I think the emphasis there is, just as you suggested, is to practice the speed reading. That is really so important. That.
And to give tips about moving on. So I think I was going to bring you all in at the end, because there's various types. So what we did, we asked our students to work in groups using the two different websites. So, well, it's UKCAT at Liverpool, but we then asked them to look at various aspects of the websites and then share back to the group their top tips, what they'd learned, and then the next steps in preparing for the test and creating their personal plan of how they were going to commit to preparing for the test. And then we did find, what we found in that summer school was, we did that a couple of times, and it was surprising, out the summer school, there were a lot of feedback saying, we know all this, it was okay, but we'd done it before. And there was a lot saying, thanks very much, that was wonderful, I didn't really know that existed. So you were really caught in this, what's the best use of your time? So we've developed on to now doing the practice tests, and you'll be aware, Martin, they are on the website. And this year via Zoom, I just did a kind of poll everywhere. I showed the questions, I asked the group pick their answer. It made them less embarrassed, really, about saying the answer. So we saw if it was true or false or whatever. And then I was like, well, who said true? And I was like, why did you explain that? And sometimes then people became braver and said why they'd gone wrong and things like that. But it was about showing them the different types of tests. And to be honest, although that worked on Zoom, and it's possibly what we'll be forced to do this year, previously we had done it in little groups with our students, because there's nothing nicer. To be honest, sometimes I like to keep out it and run it with a student facilitating the group, because they've had more relevant experience of it. They've actually sat these tests, so it's more authentic and better advice. So that's what we did in relation to the UKCAT and BMAT. So I was at the stage of throwing it out to you, and you've raised the point about the SJT, Juan, and Martin, yours was the verbal reasoning. Is there anything else you'd want to do? Is there any way you prepare your students? Because they will be sharing the recording. So, I mean, I'm sure people would be interested in your points of view.
Well, really, just to emphasize what you've already said, actually, I think we're all aware there's very many commercial organizations out there that are looking to take money off students on the promise of easing their way into medical school. And actually, I've already had several emails from my group who themselves have had emails from these organizations offering various packages, and they haven't even looked at the UKCAT website. And I keep saying to them, before you do anything else, before you go anywhere else, look at the UKCAT website. And as you've just said, there's 1,000 questions.
It's
any amount of
wonderful
materials
now,
on
really.
there.
Yeah. Thanks for that. I think that's a real valid point, actually, to look before you do anything. I think, if anything, I would just buy a book of extra questions if I was buying anything. Juan, you were going to speak. What were you going to say?
No, it just, I mean, basically supporting what you both are saying, that, we try to basically make them aware of the test. I mean, we've only had one cohort last year, that a student that sat it, and just making them very aware of their strengths and weaknesses, and also managing the stress of doing the test. This is something, one of the reasons why I wanted to come to this meeting is actually how stressful can be the application process, the interview, and actually getting started in medical school in a COVID environment to added injury. So because obviously it's not doing an interview in Teams or Zoom, it's got complete different skill set, because obviously in some ways, your body language can be more obvious or less obvious. And so there's different. So basically, sorry, what I was trying to say is that we prepared them, we made them aware of the exam, and do some, and obviously mentioned that practice makes perfect, that you can practice, but also there is like a peak. I mean, there is a sweet spot that the student, after practice, they don't get any better, and they can over prepare for the test. That's all I wanted to mention, that sometimes the students can over prepare and over worry about it. That's all I wanted to share.
Okay, thanks. Sorry, I was just going to bring Jacqueline in, but there was even an orange thing flashing on my screen, and I wondered, but she's had to leave because she had a placement. But that's fine. Juan, thanks for that, because I think you're right about the interviews, but having just come through that, I think, and we'll touch on interviews in a little while, I think you'd be surprised at how well the students did in those interviews on that online thing. It is more difficult. For example, I'm aware myself, I've got various screens tied up to my laptop, so I might not be actually looking directly at you, but I do think that they really did very, very well, the students on the online interviews. It was amazing. So I'm just gonna sorry, you can tell I'm a bit of a technological dinosaur, to be honest. But, so we've got, the next slide is this MSC statement on the core values and attributes needed to study medicine. Had either of you ever accessed that before for your students?
100%. Definitely.
Yeah, I mean, do you find it useful? I must admit I do. And I'll just show you what how I use it. I mentioned it earlier. There's a couple of things we do in the school, and one is the good medical practice document that Simon, he worked in Liverpool before he went and to Edge Hill, and I'm struggling with the name for a minute. Simon mentioned it this morning. So it's in 4 areas, and they're all things about, you know, medical practice of a doctor, the importance of maintaining trust, safety and quality, communication, etc. So you see the 4 domains there. But one of the tasks I give the students to do is actually think about the list. So that's the list there. And then you can map them into each of these domains. And obviously some of them fall in all of them and some of them. And it's not so much if they fall in one more than the other or they fall in all. It's about actually thinking about what the skill is and why it's needed. And in doing that, you actually are expanding your knowledge of what the role of the doctor is. And I mean, one of our interview domains this year was just understanding the role of the doctor. I mean, that was so bland. Loads of things could have been put on it. I could have picked up just one of those things had we wanted to, but we were kind. It was much more general. But the thing is, again, if you do it in a small group thing, it's getting people discussing, it's getting them considering other points of view and actually kind of analysing the evidence. And it is sort of thinking about the role of the doctor. The other thing we do is this is called the Fiona Watson Save Money campaign. I print out the little pieces of paper with the things on it and put them in a brown envelope, and I pass them around the group and they take out something. And this usually in a face-to-face session, we would have our students primed to do it, but they would actually take out the core value, and they would then be given some time to think and then talk about how they could evidence that attribute in their personal statement or an interview. So it's from their own experiences, whether it is a shadowing experience, which we say isn't necessary, or some sort of caring, if it's McDonald's, if it's working in a restaurant, it's what have they got to talk about? And then they share this, and they feed back to the student or sometimes to me. And what I've also done is we've kind of developed it into a way for preparing for interview as well, because once if, for example, the attribute was teamwork and they tell me the evidence, they would then know that I was going to hit back with a question in response to that. And we'd then keep the discussion going until it naturally dried up. And then sometimes I would say to the others in the group, well, what did you think of that answer? Do you think there was something missing? What do you think could have given that more depth? Because I think, I mean, at Liverpool, again on the chat this morning, I saw about the MMI, a comment about the structure in the MMI. And at Liverpool, we use a semi-structured MMI or a semi-structured interview because we always have the same lead-in question, but then, and we stay on the same topic, but we will follow up based on the answer. Joanne, you wanted to come in again? You're muted still. Oh, you're still muted.
As a teacher, I would say this, obviously, because we do that all the time. And in the new inspection framework, questioning the student why we're doing what we're doing is part of the, the Ofsted inspection. So obviously I am trying now, when I'm teaching the maths, or the biology teacher is teaching biology, is poking them to make them think on the spot, know, because getting them used to that on a day-to-day basis, well, what that, and then hang on, okay, but then what if to considering possibilities, considering, trying to get them into a dilemma or mini dilemma about, solving a question. So we're trying to implement that in our teaching, or for example, talking about the R number, when I was explaining geometric progressions, I was thinking about, what do you think we have to keep the R on the 1? So trying to contextualize everything all the time. So I think that is something that if you're a teacher,
you do naturally.
You can embed that in your teaching. Sorry, that's just a comment.
No, I think that's really good. And I think it's right. And it is, because I do think it is being able to have the confidence. And I think like that, if we go back to what I was talking about initially about creating a safe environment, about reviewing the websites or whatever, I remember we do case-based learning now at Liverpool, but for many years we did problem-based learning, and I guess some of the things overlap. But when I was involved in problem-based learning, on the very first session, you always set the ground rules of it, and it was like, there's no silly answers, everything's confidential within the group, we don't make fun of anyone, and there was lots of things that were the ground rules. But then it built up time for people to share things and get comfortable sharing. So I guess like starting off with a few easier things like this and realizing that nobody's saying that's a silly answer, that yeah, that was good, how can we make it better, have you thought of adding this in? That's a much better approach than just going with something really difficult that they can't answer in the first place. So that's how I developed their interview skills, really. And Martin, did you have any tips on what you might do and how you use those core values and attributes? Because you said you'd looked at the site.
Yeah, the first thing to say, actually, we're using your envelope idea. That's brilliant. I think that for me, yes. I mean, in the past, what I've done is say, particularly when it comes to writing out the personal statements, and as you will well know, you must have read a lot of personal statements. It's just a litany of work experience, things that they have actually done with very little reflection built into that. So what I've asked them to do is to give them that statement from the MSC on core values and attributes, and say, look, when your admissions tutor is reading your personal statement, that's what they're looking for. So therefore, you have to read across from your personal statement to those core values and attitudes, and see how many you can actually identify in your personal statement, because that's what the interview. And I think really that now there's less emphasis on clinical work experience. It allows people like me to give that more focus on developing those other attributes, which, as you say, are probably more important.
Yeah, I think it is, and I think the mapping of them to knowing the doctor's role is quite important, because I think what I do find with interviews, even when you ask a very targeted first question, a lot of them will say, if it's something like, why do you want to be the doctor? They always tend to go for the, well, I want to care, I'm good at caring, or I've got wonderful communication skills. But very few people address the other professions care. As teachers, as careers advisors, you care about people and you try to help them to the best of your ability. If you're a nurse, you're caring for people. And you've got really to get them to have very focused thoughts and reflections on why they particularly want to do that role, and that a clear understanding of what it involves. So I think it's that kind of additional focus that's sometimes missing. And if I'm going off subject, but communication come up as well. And another one's professionalism, that over the years we've noted communication and professionalism in an interview situation. The students tend to throw around those words, but actually ask them to break down what makes good communication, or what is professionalism. That's a bit more difficult for a lot of the students that we interview. And sometimes you can ask the first question and then with a little prompt you get a really more in-depth answer. But sometimes they won't really understand that communication is taking on a lot of different things, and professionalism too. As the slides are coming around, but I just listed a number of websites. There was some that come up this morning as well. So they'll all be circulated from you. So if you've got anything that you think that we've not discussed on those websites or came up today, please put them in the chat and things. I did make some notes about
just before you go on, Fiona,
yeah.
At some point, could you talk about resilience and the importance of that? I think that the people, it's unfortunate that Jacqueline's left actually, but I would imagine that what they are bringing to the party is just that the struggle that they've had to get into medical school, as compared with the students I'm working. The school I'm in is a high performing school with kids in there who are expecting to succeed, have not really experienced actually failure, and that's one of the things I'm having difficulty in actually getting across.
Yeah, do you know, that is that's what I was going to open out at the very last slide.
Apologies, sorry.
No, I tell you what, I'll finish off this and then we'll go to that last discussion, and because I'd like to throw it into the bag because it's one of the big problems. So one of the things about developing confidence that worked well in the summer school, I'd like to share this. You might be able to adapt if you can get a hold of a few medics. And it wasn't the medics doing mock interviews to the student, it was the students interviewing the medics. And so we put the students in groups of 5, and I had no idea how this would work. But we then had one of our members of staff come along and be interviewed by them. So they were given some time to think about who would start there were rules set down, who would start the interview, what would be the introduction, what would be the opening question, and they'd all have an opening question. And the idea was, you welcome the person to the table, you ask an opening question, you listen to what they say, and you respond with another question until your time runs out, and then you go to the next interviewer in your panel of 5. Now, I had a few good things. I think I did it with a couple of our students the first time, and they admitted to me after, they said, didn't know if that would work, Fiona. And I was like, no, I didn't know if that would work either, boys. But it really, for you, Anne, you know what it did? It let those students see that they would be interviewed by normal people with normal lives, that actually weren't scary individuals. But it also developed their listening skills and the spontaneous response, which is what it's all about, that discussion. So I just thought I'd throw that in there as an opportunity, as something that has worked well for us. But then to Martin's big one. And this is what was going to open out for the next 15 minutes, because it is like, that's, I took the view in doing this that it was about confidence and well-being are kind of linked in some respects, and that it's about being well prepared for your tasks. But I think there's some things like the resilience is difficult to cope with, and I think certain things like reassurance that you don't, in your case, Martin, that your students don't need to be the most excellent student in their year group. They're not competing with other people. They're just doing the best they can and need to progress. That they manage their time. That they practice organizational skills, and that they that the comfort, they need to be encouraged to share their issues early. Because if you keep something to yourself, then you're not getting help during that time. So I think like creating opportunities to share their issues is a good thing. So for example, just looking down around this, there's various things. We've got an academic advisor scheme. So my students, you actually take them for 2 years if you're a non-clinician, and then they move to clinician for the latter 3 years, if we can manage that. And it's about giving that opportunity of reviewing certain things and asking the questions to them and seeing how they're doing. I think it's about links with peers, and just giving the opportunities for them to, like, maybe cake and chat or something, so that they can share their own problems and get some sort of support from people who've been in similar situations. So that's why we have like peer support set up, so that they can discuss it. I think it is difficult sometimes. A student getting advice from someone my age is something sometimes different from going and sharing it with their own individuals. I don't know. I don't know how. Joanne, you've got your hand up. Have you got anything that you?
Well, something that that we do, and I don't know whether Martin may find them interesting, is that we try to, we actually, the students, when they embark with us, we put them in an 8-week mindfulness course that to make them aware of, obviously, for themselves, and also mindfulness use as a clinical. So obviously, in order to sell them, because I think this is weird, mindfulness. And then I mentioned, the NICE, how it is a well-established, therapy in the NHS, but also how them becoming more aware of, when I'm feeling nervous, and giving them techniques to calm down and to actually understand things, such as we begin to link with their neural system as well, so we try to put them in a kind of medical background that, how the stimuli comes into the, through the brain, and then how can you, through breathing. So we do it in a kind of quite semi-technical way, but actually students say, well, actually, when I was in my interview, I did a little thought box, which is feet on the floor, boom, on the chair. Basically, they bring their attention. I said, and that actually did help me. So it helps them to actually to be themselves the best they can be in an interview situation, but also they will carry that. Because I said, look, being a doctor, if you think this is hard, preparing to go for medicine, that is nothing compared to being a junior doctor. So if you think that this is tough, being a doctor is much tougher,
I think I'd say it's quite good to emphasize that it's progression, though, isn't it? Because I remember a student who helped us in our multiple mini interviews a couple of years ago, and I'd not seen him for a year or so, and because we're a huge medical school, and I was like, what year are you in? And he's like, oh, I'm in 5th year, I'm graduating. And I was like, wow, that's wonderful, because it seemed like about a year ago, but I remember that particular student, and he was like, didn't know how to find the library. I asked him in a small group, why haven't you prepared for the session? And it was, I don't know where the library is. And I was like, oh, it's okay. Most of our resources are all online anyway from the library, but it's only up the road. It's about 100 yards away from here. And but one of the other students said to me, it's okay, I'm walking past it when we leave, I will take him. And I think, seeing the progression of that student from that young lad who actually was quite out of his depth in a new environment. His mum hadn't sent him a textbook, and I was saying, we advise you not to get one until you've read a few around and you decide what suits you, and they're all online in the meantime. That seeing someone develop like that, I mean, that's just a kind of one instance of some anonymized individual, but actually seeing the development of these young people over 5 years and all the things they achieve. So it is a kind of, that's another good thing about linking up with peer groups and students who come back, because it does show that there is a, you know, a learning curve that can be quite significant and people can transform really, which is good.
I'm really glad that you mentioned that, because one of the students on the call before, Tarun,
Yeah.
he's in Lancaster. I taught him A level 2 years ago, and he was a very, very nervous individual. And when I saw him talking so confidently, you know, in a room full of strangers, you know, and I was like, wow. And when I saw him, I said, Tarun, is that you? Because I you know, obviously then, you know, and they said, yes, it's me. And I said, wow, I'm so proud of you, because it's just, you know, so brilliant, you know, that, and it's just 2 years, in 2 years. So yes, sorry.
No, exactly. And another instance, I was at graduation, the last one before we went off campus, and there was a student there and she was graduating, and I was surprised it wasn't the year she should have graduated, but that student was a resit student in my first year group. And the reason she was a bit later than I thought, she'd completed her intercalated masters and everything by the time she graduated from us. And yeah, another hugely success story, and there's loads of them in lots of medical schools. And I think that just these little hiccups, so actually if you can have students who actually have had a difficult time, obviously confidentiality is maintained, but if they can actually share that, yeah, I did have to reset that, and yeah, I did progress, and I'm now doing this, that is a great thing. And actually, like, we're trying to improve our websites all the time. Again, it takes time, but to show people from different backgrounds and different hurdles they've got to come, actually going on and really loving their careers, which is a good thing. So I don't know, kind of got off the topic, but Martin, have you got any advice on the resilience thing? Because it is a huge issue. The mindfulness thing I think is really good, because I think we work on that as well.
I think actually on the resilience thing is the story of my own daughter, actually, who applied for medicine straight from school, was holding offers from Cardiff and Manchester, and unfortunately dropped a grade. Well, it wasn't a grade. She was sitting in the IB actually, so she dropped a couple of points in the IB. And straight really, she finished up in Liverpool doing tropical disease biology. And I think she gained enormously from that. So it just allowed her to be a student. She joined the University Royal Navy unit, and they took her flying and skiing and all of it. And I think when she finally got into the medical school at Bath, she was far more ready for it. She really was. And I think that's one of the I mean, a lot of, as I say, the students I'm working with see it as a total failure if they don't get into it first time round. But I'm constantly pointing out the sort of the benefits of alternative routes. Sorry.
No, I think that's true.
Yeah.
I think it's
to actually GEM applicants, actually, Fiona.
Sorry?
How much waiting?
If you really want it, if you
we have a graduate entry medicine program currently, so we don't have that many coming into our main program because they choose to apply to the graduate entry medicine program. That may change in future because we're always reviewing what we offer, but that's the current situation. There's about 16 graduate entry medical schools in the UK. I'd need to check how many applications that adds up to, but there is that, you know, second chance, or for example, people who just leave education or go into different types of work to re-enter via an access scheme to some medical schools or a foundation program is a valuable route.